news, in fact, breaking news about your heart. Is open heart surgery becoming a thing of the past? Well, we all know someone who's had that kind of invasive surgery with the big cut in their front. It's made with a device like this that we use as heart surgeons to saw open the ribs and expose the heart. I grew up doing this. It's pretty invasive. But a big new study shows there may be a safer, easier way to treat one of the most common and serious conditions that can affect the valves of the heart. And guess what? 2.5 million people in the U.S. have this problem right now. It's called aortic stenosis. And here's what it looks like. There's the heart, right, pounding away, and there's this big tube coming out of it that it carries blood to the rest of the body, like the brain and the other organs. Inside the heart, the blood goes back and forth across this valve. But this valve, which is importantly regulating the blood, when you look at it from above, opens up like a Mercedes-Benz sign. But if it gets stenotic, if it gets scarred in like this and get little pieces of calcium on it, it can't work. So it makes it harder for the heart to push the blood out to your vital organs. You get symptoms when this happens because the heart's backing up. You start to faint because no blood's going to your brain. You get shortness of breath. The blood backs up in your lungs. And when it's severe, right, it can cause life-threatening issues. So about 2 decades ago, 2 innovative engineers, 2 cardiologists had an idea. What if we could fix this problem with only making a small incision in the groin and replace this valve with a catheter instead of using that saw that I used earlier? They asked me to help design the device, and now a new clinical trial, all these years later, suggests that this treatment, now it's called TAVR, T-A-V-R, may become the best option for everyone. And I want to introduce you to my friend, Dr. Marty Leon. Martin actually, he helped lead the development of the device and the TAVR trial with Michael Mack and some great engineers, both named Stan, by the way, the Stans. So show everyone how this works and how much effort it took to make this happen. So you basically make a little cut in the groin, and there's the catheter.
The catheter goes up, we snake the catheter across the aorta, then we cross the old valve here, the diseased valve, and then we expand the new valve. And you can see the new valve is expanded, and now it works like a normal valve.
And looking at it from above, you'll notice I showed earlier how it got scarred in. Now it's working normally. And one big idea here, which actually very young doctors share with us, was you don't have to take the old valve out. You can just actually push the old valve to the side. It's like mortar, right? It actually holds our new valve in place. So give us the summary of the results. This was front page news everywhere around the world.
So this device, this technique, was originally going to be used only for the patients who were very high risk for surgery. What we did was now the 5th randomized trial, but it's in low surgical risk patients, which is the majority of patients with aortic stenosis. What we learned was that after a year of following these patients, there's 1,000 patients in this clinical trial, you compare surgery versus TAVR, we learned that there was about a 50% reduction in death, stroke, and rehospitalization at the end of a year.
If you use the catheter system, the less invasive system. So it's the best of both worlds.
Exactly.
Less invasive seems to work maybe even better. And listen, we don't have outcome past the year, really. Right? In general, you don't have to wait 15 years to see if these valves will last as long as the old-fashioned ones. But this is really good news for a lot of you. So come on over here. Marcy's joining us. She was part of the clinical trial, and you are brave to have done this. Let me hand that to you. That's what your valve looked like.
Wow.
So what do you think?
It's amazing. I never saw it. It's in there.
This is actually, Dr. Leon told me, the exact same one you have in your body. What was it like being randomized in the trial?
It was wonderful. I didn't know until 3 days before that I was going to be chosen or picked. And so I'm delighted because I had a friend that had coronary disease, and she had open heart surgery, and she has not been the same since. She's had complications. Mine was a wonderful experience.
Well, as a surgeon, I've always believed part of my job, come on over, was to put myself out of business. Right? The status quo wasn't good enough. You want Marcy's of the world bragging to their friends about how well they're doing. So I've got all these young people, doctors, nurses, this is one of my partners, by the way, Isaac George, working together to make these advances a reality. And my colleagues at the hospital, yes, you should think, because it's the young folks that are changing medicine. Advances so quick, we barely keep up with it. Marty and I, with our graying hair and years of work, can only hand the baton off. But it makes a huge difference because the bodies don't change, but technologies do. So I want to congratulate all of you very much from the bottom of my heart for making this all possible. And congratulations to you, Marty, for never giving up and being persistent, having a lot of grit. Congrats to you as well. We'll see you all next time.
Zero calories,